Today we are going to discuss about pressure tension theory. Schwartz proposed the pressure tension theory in 1932. The pressure tension theory is the classical theory of orthodontic tooth movement. According to this theory, whenever a tooth is subjected to an orthodontic force, it results in areas of pressure and tension. The area of the pedontium in the direction of tooth movement is under pressure, while the area of pedontium opposite to the tooth movement is under tension or being stretched. Tension or stretching of periodontal fibers is associated with the bone deposition, whereas compression is associated with bone resorption. So, whenever an orthodontic force is applied to the tooth, there occurs a pressure side or compression side and a tension side. On the compression side, blood flow is altered quickly, leading to decreased blood flow, falling oxygen tension level, which leads to change in relative proportion of metabolites within minutes, and there is release of other biologically active agents like prostaglandin, calcium 2+, cyclic AMP, protein kinase enzyme, etc., leading to increased cellular differentiation and activity, and more osteoclast on the compressed side, and bone resorption happens. The things that happen in cellular differentiation include first, activation of extracellular signals, then conversion of extracellular signals into intracellular signal, then phosphorylation of the cells. Phosphorylation results in differentiation and activation of osteoclasts and osteoblasts, which ultimately produce brain. On the compression side, blood flow altered quickly, leading to decreased blood flow. There is fall in the oxygen tension level, which leads to change in relative proportion of metabolites within minutes, and there is release of other biologically active agents like prostaglandin, calcium, cyclic AMP, protein kinase enzyme, etc., leading to increased cellular differentiation and activity, and more osteoclasts on the compressed side, and bone resorption happens. The things that happens in cellular differentiation include, at first there is activation of extracellular signals, and then conversion of extracellular signal into intracellular signal, then phosphorylation of the cells. Phosphorylation results in differentiation and activation of the osteoclast and osteoblast, which ultimately produce remodeling. Tooth movement begins as the osteoclast and osteoblast remodel the tooth. On the tension side, there is increased blood flow, leading to changes in the chemical environment, alteration in the cellular differentiation and activity, and more osteoblasts are differentiated on the tension side at position, and new alveolar bone formation occurs.